Live. Cool. I think we're live now.
Okay.
So technically, this is round two. You're not seeing this if you're watching this, but my name's Alex Barker, founder of Pharmacy School HQ, and I'm super pumped because right now we're talking to Mel Seabright, who is a pharmacy benefit manager expert, and we're going to learn about this kind of niche career within pharmacy. So Mel, welcome. Thank you so much for sticking with me.
Absolutely. I wasn't going anywhere. We want to get this done and teach people about pharmacy benefit management.
Awesome, man. So give us the 30,000-foot overview, who you are and what you do.
Sure. I'm Mel Seabright, and I am a clinical pharmacist for a pharmacy benefit manager, PBM. So I'm experienced with PBMs, managed care, etc.
Okay, so what is managed care, PBM? Are they interchangeable? Give us again another 30,000-foot overview of this niche of pharmacy.
Sure. Managed care is just it's what people come into the pharmacy and pump their fist about, having somebody tell them what they can and cannot do.
Oh,
So
yay.
so there's a little bit of the dark side of the force going on here, in some people's view. PBMs are a group of companies that work to control cost. They're a subsidiary. Normally when people think managed care, they're thinking about HMOs, PPOs, insurance companies. PBM is a subset of that, different companies. CVS Caremark, Express Scripts, Catamaran RX is upcoming. There's actually quite a long list. People that different companies have various pieces of the pie. But the goal is just to control costs and trends. Generic dispensing rate. Most of these companies have mail orders, so they're looking to get patients to use generics, get patients to use formulary agents, get patients to be adherent. That's something that's been more and more. Reduce access or decrease costs for specialty drugs. I mean, that's been huge for a long time.
So is it kind of like an insurance company hires or has a PBM section of their company, or they hire some company to manage their formulary? Is that kind of the big picture?
Yeah, either or. For instance, Cigna is an insurance company. They've had a PBM for years. United Healthcare is an insurance company, and they've had a PBM for years. Or somebody like Aetna will work with CVS Caremark, which I know a lot about with that. So they have a 10-year agreement with those two companies for CVS Caremark to manage their drug spend for Aetna.
So when we think about managed care, we're thinking about cost, insurance. Why? Well, I want to talk about maybe personality.
Yes.
I'm not in managed care.
Yes.
But is there a certain type of person that fits in really well in managed care? Like, do you need a certain set of skills, abilities, traits? Have you noticed any patterns?
Well, I'll tell you this. If you want direct customer feedback, you want to work with patients directly, you want to look them in the eye and help them, you can't do it.
Okay.
There is zero direct. You can speak to someone on the telephone, but you're not getting that connection. So it's a step back. So that is probably the first thing that I tell people, so they understand that.
So if you don't like people, then go into managed care.
Well, you can help people. You
I'm
can
just kidding.
definitely help people, but you're not going to be able to see them every week. You're not. I mean, you might talk to, if you're in medication therapy counseling, for instance, you can speak to the same person every week, but it's not really the same connection. And if you're working in a mail order pharmacy, you don't know the patient. You don't know the prescriber. A lot of the times you can learn a lot by filling prescriptions for the same prescriber over and over. You can know that they have certain trends, or they They write their E's a funny way. You don't get anything that. Anytime you see something, you've almost never seen it before. So, there's no familiarity. So that's a challenge, because when you hit a mail order script, you push a button and then it's filled by a robot and it's gone. It's mailed. So, there's no walking over to the pharmacy shelf and being like, I need to double check that. So that part's a little scary.
Okay.
Yeah.
Well, what are some benefits of going into managed care versus maybe retail, hospital, or some other field?
Well, I would say, and this is just me, I would say overall, I'd say there's a little bit less stress because you don't have patients upset with you. You were controlling a lot, and obviously, if you're on the phone with patients, obviously you can get upset about that. One of the other things is that there tends to be a better schedule, and that's what drew me into it. When my wife was 2 years behind me in pharmacy school, so when I was graduating and coming out, I wanted access to weekends so I could go see her, and because I was completely lovesick and I couldn't imagine working weekends all the time and not seeing her. So I had every weekend off, and I still do. I get to basically set my own schedule in my current job. I leave the workplace at 3:30, and I'm home with my kids, with my son every night, and my wife every night, and weekends. I mean, that's a big plus. So I'd say there's some big time quality of life benefits there.
Yeah, and I think once you get into the field of pharmacy, you start practicing, you start hearing about quality of life complaints from your colleagues, your old classmates, and that sounds like a huge benefit. Well,
it is.
Tell us about a day in the life. Quickly run us through, like in a minute, what does a typical day look like for you, and now talk to us about the hours as well, because you just said you left at 3:30.
Yeah.
Not too many jobs get to do that. So tell us about a day in a life.
Sure. I drive to a big office. It just looks like a commercial office. I get started. I start at 7 because I want to, because it's easier for traffic. I work at in a office, or some of my other colleagues work in a cube at a different office. We're in Pittsburgh and Scottsdale, Arizona. So I work in an office. I log into a computer. The cool thing is that they trust me to do my work. There is no one looking at me all the time. I'm completely hidden away to work. So so you need, in that kind of role, you need to definitely be the self-starter person that can really get off the work, because if you're a procrastinator, that can cause a problem. But so I go in, I work, I log into Microsoft Word, and I work on Word documents. Basically, they are prior authorization criteria, and I create the questions that would be on the fax to a prescriber, or the questions that would be read to a prescriber over the phone in order for someone to get their medication. Okay. So I help create what is being asked or required of the prescriber for the patient to get the drug.
So you're kind of like a gatekeeper with multiple questions, kind of like in Monty Python and the Holy Grail.
There you go. Yeah, absolutely. Yeah, I am, and some of the things are being handed over to me. Some of the things, like someone in the company says, this is the question we're going to ask, or sometimes we'll have a client that they want to create custom criteria, and we may not even agree with it, but there might be some wacky stuff, and we'll just be like, okay, so we create it, and it's fed to us. But sometimes we get a lot of leverage, so we can determine the wording, we can determine how strenuous it is. I mean, we've recently gotten rid of all prior authorization on low molecular heparins and the anticoagulants like Xarelto, Brilinta, Equus. We've gotten rid of all that. I mean, that was a decision that our team just said, this is too big a risk. We could hurt people. We need to just get rid of this. So we get to have some say over what is being on prior authorization and what isn't. So what can someone just walk in the pharmacy and get versus what does someone have to work at a little bit to get?
Okay. Talk us through how to start a career in PBM or managed care.
Absolutely.
And you're in pharmacy school, like what steps should you take to get started? Should you pursue a residency? Could you just start a career? Could you transition out of retail or hospital into managed care?
Yes.
Walk us through like what advice you would give to even pre-pharmacy students. What would you say they should do?
Yeah, absolutely. When you're starting out, you have a couple different options. If you have the opportunity to do a residency, my general advice for residencies, and I know you didn't ask me, so I'm going to say it anyway. My general advice for residencies is that if you do a residency, you make sure that it gets you where you want to go. Don't just do a residency to do a residency. Look down the line and say, what will this residency help me do? So if you do a managed care residency because you really want to work in managed care, that can be a real door opener. I mean, I've seen people jump through multiple steps, things that you would normally have to go through. Normally when you work in a company like that, you might have to do mail order or patient calls or whatnot, and sort of earn yourself up the ladder and hope that impress people and work your way up into a more clinical role like I have right now. If you have do a managed care residency, you might just get that clinical role. You might be able to just jump into a clinical advisor, clinical position that pays quite well, involves like direct working with clients. So I mean that can be very interesting work and you can learn a lot. Managed care is very complicated and the companies are big. I don't know what other departments are doing. If you do a residency, you can jump right in. You can learn a lot about a company and about the marketplace, and jump right into a big job. So it is very valuable if you do it correctly. So just make sure it's a quality program.
Can you get into managed care without a residency?
Yeah, absolutely. In fact, I did. So the main thing is just to know what companies are out there. You could do a managed care rotation like I did in pharmacy school. You could just sort of get a taste of it with no qualifications. We have pharmacy schools. Students come in to the office all the time. I'm in Pittsburgh. We have students come in from Pitt. We have them come in from LECOM up in Erie. We have them come from West Virginia sometimes and Duquesne. So we have students come in. Sometimes they just come in for a day. They come in, they ask you what you do, so they get a little taste of it. That's a great opportunity if you have the access for that in pharmacy school to just go in and see what people do. And, because your pharmacy school will not tell you about managed care. They will only tell you about retail and hospital. And there is a whole world of roles out there. So I hate to see people think that there's only two choices, because there's a lot of other things pharmacists can do.
Well, tell us what advice you have for the real go-getter. I have in our future pharmacy resident group on Facebook, I have a P1 student that was talking about becoming a pharmacist in managed care.
Great.
Like, should they try to find the email address of the closest pharmacy benefit managers and say, hey, could I come on site? Can they try to get a technician job in managed care? Is that possible, or an internship?
Yeah, internship's definitely possible.
Okay.
We've had interns. Of course you can come in. I would recommend the website. It's called PBMI, and I think it's just Pharmacy Benefit Manager Institute. That website basically lists every PBM working in the United States. So it lists them and tells you their addresses. So that is a big start. Now it might tell you that their corporate office is in the Chicago metro, and it might not tell you that they have a satellite office where you live. So you might have to do a little digging, but that's a great place to start.
And it is pbmi.com.
Yes, pbmi.com. There's a wealth of information on there to get started. And I think a lot of companies will allow you to come. I think that one of coordinate that through your school of pharmacy. There are internship jobs available. I mean, you can definitely get your foot in the door that way. I would recommend starting with PBMI and seeing what is near you. That's a great way to start. And there probably is somebody at your school of pharmacy that knows something about managed care. I had a teacher that used to work at Medco, and when I went through Medco, I laughed at some of the stuff that they were doing like 5-10 years before they were still doing. It's a small world out there.
Mm-hmm. Now, I know a lot of students are introverts, and I see a lot of students struggling with saying, I'm really scared to go talk to a manager. If I email them, what in the world do I say?
Mm-hmm.
I think what you just suggested, talking to a professor who maybe could introduce you to someone, is a really great way to start a relationship.
Mm-hmm.
Do you have any other tips on how they can get the ball rolling? Like, should they draft up an email and email every manager that's listed on pbmi.com, or any advice for that student who's a little bit scared?
Well, I would say if you want it, go for it, and the opportunities are there. If you haven't signed up for LinkedIn, now's the time. Because when you're in pharmacy school, you're going to meet a lot of people who are going to be future pharmacists, and those people can be a real help to you. So I would say to do that. And, when I connected with some of my old college professors, I ended up seeing, when I log in, I see a lot of people who went to my college of pharmacy. So they can see me when they log me in and see what I do. So that would be, that's sort of a backdoor opportunity. To see people, and I definitely think you could email someone. Just don't be disappointed if you don't get a response, because some managers aren't going to be that interested in coordinating that. So you may have to send some things out. You might be able to just walk in. I don't know. It's possible. You might be able to walk in, say, I'm a pharmacy student, talk to a receptionist and say, how could I talk to someone about what it's like to work here? I mean, I was told that someone I used to work with, who has a much better job than I do now, she got her job at my employer by walking in one day and saying, "What do you do here?" And now she's doing great. She has this great job, and she gets to still be home for her kids and stuff. I mean, it's fantastic.
You're really selling me on managed care.
Yeah.
But with every single job that ever exists, there are always downsides. Is always something that can grind your gears or make you wish you didn't choose this path. What sort of things kind of grind your gears about managed care?
Well, first of all, if you tell people what you do and they understand what you do, they can be a little put off. Good luck going in for your annual physician exam and telling him that you might have something to do with his prior authorization being denied. That doesn't exactly make you hit at parties. But it's worth. I think it's worth it. I think I mentioned the lack of direct patient contact. I mean, that is key. There's a certain population of people, a certain number of pharmacists that just couldn't do that. Like, they want to be able to look the patient in the eye. They want to be able to see. I think in different roles I have helped people, but I don't see the end result. So I don't know who I helped. There's sort of a lack of completing the cycle and feeling that personal satisfaction. You have to be okay with that. I'm okay. I'm an introvert. I'm okay with I'm not. If Alex had 10 other people on this chat, I'd be completely lost. It's just I'm telling myself it's just him and I, and maybe there's another student listening, so that makes it okay for me. And certain jobs within the PBM are better than others. If you're working in the mail order, that can be quite stressful. I was in an office with 300 people. We're all filling prescriptions. There was like a big urgency. They did a lot of numbers. How many prescriptions did you fill? And they would there was like a lot of pressure to write. So when I worked at Medco, 1 month I was employee of the month out of 300 pharmacists, and then the next month, because I had rushed and done so many prescriptions, I was basically playing good cop, bad cop with someone because I had misfilled something. So there's a lot of games like that, especially with filling the prescriptions. And some of the patient calls are pretty rough. I mean, I don't know the details because I've never done it, but they do the same thing where you have to make so many calls per hour, and you may have like a little old lady that wants some advice on something, and then you have someone else saying that you need to get up your calls. So you feel like you're cutting somebody off, or maybe they're just telling you an interesting story, or they're lonely and they just want to talk to someone, but you don't have the capacity to do that. So I mean, I think that could be rough in those positions. I really like what I do now, and it's hard for me to tell you what's so bad about it. Although I will say this, there are different PBMs at different sizes. If you work for a big company, okay, Express Scripts, CVS Caremark, maybe even a little bit smaller company like Catamaran, some of these companies, what you do is very specialized, so you only learn this one little piece of everything. I think it might be interesting to work for a smaller PBM possibly and learn a lot more because you can do multiple roles. At one point, I talked to a company, and their job was basically what would have been 3 departments in mine. But you would have learned so much and had so much experience and so many things to have your put on your resume, and to be confident about being able to do.
I'm going to change the subject just a little bit, and I wanted to ask you about the transition from school to actually practicing. Did you struggle with anything in those steps in between? Like, what was the biggest challenge for you after graduation?
Living arrangements, I suppose.
How so?
Well, okay, so I went from Ohio Northern, which is in Ada, Ohio, which is technically a village if you don't count the School of Pharmacy. So I went from there, and I grew up in a small town, and I went from there to Cincinnati, Ohio. And I had never been to Cincinnati, Ohio, but that was where the opportunity was. So I was always just we'll figure it out when we get there. So I was by myself, and I didn't know where to live or what was safe or whatnot. And the recruiter for the PBM was just like, hey, we've put some other people in here or whatnot. It was a terrible place to live. And, so I ended up with a really lousy place to live until that rent was done. So, make sure you live somewhere safe and you can live with, because, you get this job offer and you're like, I got to pick a place to live. So that can be kind of crazy. Finances, obviously, you have students, almost all of you will have student loans coming out, and those bills are bigger than you think. And, I was trying to coordinate with that. I didn't have very much money in college,
Are you still paying off your student loans, FYI?
I am not.
Oh.
Yes, I am not. You know what you can thank that for is the employee stock purchase plan. If you work for a PBM and they have an employee stock purchase plan, now I can't guarantee anything obviously, but they sell you stock at discount. So, long story short, you save at least 15% off of whatever it goes off now, and if it goes up, then it's just more money for you. So I made a lot of money doing that.
Do you remember how much loans you had for pharmacy school?
I don't know. Maybe 150,000 or more.
Oh, yeah.
Yeah, I don't know. Ohio Northern's not a cheap school to go with. It's private and it's kind of expensive, but it's a nice school. I'm glad I went there, but yeah, no, it was expensive. But it's worth it. When you come out, you think you have all this money, but you know, there's a lot between taxes and school loans. I mean, you know, I needed a new car, and I also was saving up for an engagement ring. So yeah, it was tight. I worked a lot overtime, and thankfully that was something that was excellent. They paid time and a half when you got over, and if you worked on Sunday, they paid double time. So I was there a lot of Sundays.
Nice.
Yeah, I made a lot of money.
One question I like to end with, and feel free to share as much as you want, but thinking, you know, of your entire career, everything that you've gone through,
yeah,
what advice do you want to impart on future pharmacists? What is the solid wisdom that you wish you had when you started your career?
Okay, I love this question because this gets to some things I tell students all the time when I get a chance. Okay, the first thing is your first job might not work out, and you will think it will, but it might not. So don't be surprised if it doesn't. Okay, use your time in pharmacy school to network with people, because people end up getting lost, and thanks to things like LinkedIn, you have a real opportunity to connect with a lot of people. And you know, people search for you. They will Google you now, for sure. People will Google you before hiring you, and if they see you have a ton of contacts and you look like you've done some interesting things, that helps. The other thing, and this is very key. Please listen to this, because your first job might not work out. It is important that you be licensed in multiple states. I have lived and worked as a pharmacist in 4 states in 10 years. In a 10-year period, I lived in 4 states. You will think that there's no way you will live in another state, but it is so easy. When you take your NAPLEX, okay, you can do score transfer. And basically, it is super easy, and all you need to do is walk in and take another state's law test. I've taken all 4 I've taken 4 law tests for 4 states. I've passed them all. They're confusing, but if you work hard, you'll do it. It is really cool to have a backup state. If you don't do score transfer, you have to do reciprocity, which is a whole mess of worms where you end up having to work with the State Board of Pharmacy, and then your license is dependent. So let me give you an example. I started out in Ohio, and I only had an Ohio license. And then I moved to Florida, then Arizona, then Pennsylvania. Because I did reciprocity, I have to pay for my Ohio license for the rest of my life, because it is reciprocity. It's like the others are dependent on it. If I had done score transfer, I could stop paying for Ohio. So, you know, that's pretty cool. So just be flexible, realize that you might make mistakes, and you know, just it's cool. A lot of people take a bad job, they don't know what they're getting into, and they want out. So give yourself a lifeline to out. So you know, just understand it. Don't be surprised if you get sold on something that isn't there.
Yeah, I totally agree, because your most powerful career tool is your network. If you don't know people, then it's very, very hard for you to find a job. And fortunately or unfortunately, pharmacy is a very small world. And if you burn bridges, and you know what, I've done that, I've burned bridges, it can be difficult for you to find another job. So always keep your eyes open for any opportunity.
Alex, I think if I return to the state of Florida, I will be shot on sight. That's how bad my bridge was burned in Florida. I hope no one ever that saw me worked with me there is watching this, because I do feel bad about how that all went. But when you're young, you think you can do anything, and things happen. But you know.
Yeah, we could probably talk, I mean, for another half an hour about all the failures that we've done in our careers.
Yeah.
And you know, and I just want to inject right now, because I don't think this is said enough, that it's okay that you fail in your career and in your college career too.
Yeah.
I've made tons of mistakes. I've been brought into, my manager's office, told me that I did this and this and this wrong, and this is a big thing. And it's okay. It's absolutely okay that you make a mistake. Like the fact that I let my cat in for this interview. I made a mistake doing that. But you know what? Life goes on, and you can still have a very successful career as long as you remember to, if you're going to fail, fail forward and be able to pick yourself back up, and don't just lay on the ground and think, woe is me.
True. And no, that's totally true. I mean, you know, I failed a class in pharmacy school, so you know, I had to make that up over the summer. I mean,
Mel,
you know,
I have to show this right now. I was cleaning my office, and I'm not sure if it'll be able to focus in on or not, but I found my biochem grade from my P1 year, and you probably can't see it, but this says 62%. In fact, it's inverted right now, so you can't read it. But 62%, and I've got a PharmD, so it is possible.
Oh yeah. Hey, listen. The minute you pass that pharmacy board, all this stuff's wiped away. I've never been asked my previous GPA or any of that stuff. So you know, when you graduate and you get licensed. Now that's the big thing. Get past your boards. But when you get licensed, you have a clean slate. So what you do from there is up to you. Don't let the other things worry you.
Mel, thank you so much for spending time with us, telling us about pharmacy benefit management. You know, I didn't know a whole lot, and you've definitely made me a whole lot more informed. If people want to get a hold of you or ask you a question, is there anywhere that they could do that?
Sure. You can hit me up on Twitter at PBM Pharmacist, or you can look me up on LinkedIn under Mel Seabright, and you know, I'll be happy to connect with people, talk to people. You know, I love talking about managed care. That's the road I went down, and I enjoy talking about it. So anything I can do for you, I will.
Thanks again, Mel. I really appreciate your time.
Absolutely, Alex. It's great to be here. Thank you.